Thank you, everyone for joining us this morning. This morning we will be going over our proposed substantial amendment. The purpose of today's meeting is to describe the adjustments to that, the activities that are part of that amendment, and some next steps. So to start off, I'd like to introduce myself. I'm Chris Groner, Director of the Department of Economic and Community Development. This morning I'm joined with the Assistant Director, Deb Smith, and Chief of Staff, Renee Lamus, and our Grant Administrator, Dave Dieter. At this point, I'd like to move to introduce the material we'll be covering today. The agenda is for the amended 5-year consolidated plan. This will be an amendment to our fiscal year 2015 to 2019 plan. We are looking to amend the fiscal year annual action plan for 2019. The purpose of this amendment is because the city will be receiving $1,866,324 for community development block grant funding and $931,503 in emergency solutions grant funding, in supplemental funding that is part of the $2.2 trillion Coronavirus Aid, Relief, and Economic Security Act, known as the CARES Act. The city will be administering the funds through the city's federal community development block grant program. The federal relief package appropriated $5 billion to the U.S. Department of Housing and Urban Development for emergency community development block grants and emergency shelter grants to help cities nationwide. Erie will receive $1,866,324 in flexible CDBG program funding and an additional $931,503 in emergency shelter grant for a total of $2,797,827. The emergency shelter grant is to help fund resources to address homelessness. Flexible funding allows for more varied uses, and the city is amending its regular fiscal year 2015 through 2019 consolidated plan and fiscal year 2019 annual plan to add the funds related to COVID-19. Now a quick review of the Citizen Participation Plan. This Citizen Participation Plan was prepared in accordance with Section 104A of the Housing and Community Development Act of 1974 as amended. The 24 CFR 91.105 and 24 CFR 5.158 federal regulations outline the citizen participation requirements. This document has been established in order for the City of Erie to be in conformance with the requirements of the regulations. The plan sets forth the city's policies and procedures by which it encourages residents to participate and comment on various federally funded city programs and affirmative fair housing planning. The programs include the Community Development Block Grant Program, CDBG, the Home Investment Partnerships Program, HOME, and the Emergency Solutions Grant Program, ESG. The City of Erie encourages residents to participate in the development of any consolidated plan, any substantial amendment to the consolidated plan, performance reports, and AFH. This document outlines the city's procedures and methods to provide continuity for participation through all stages of the process. The City of Erie also may explore alternative public involvement techniques and quantitative ways to measure efforts that encourage citizen participation in a shared vision for change in neighborhoods. The City of Erie was granted a waiver for CDBG and ESG comment period. That period has been shortened from 30 days to 5 days. At this point, I'd like to turn it over to our Assistant Director, Deb Smith, to give an overview of the 5-year consolidated plan. Deb?
Thank you, Chris. Good morning. The 5-year consolidated plan for 2015-2019 is, as the city is a HUD entitlement community, the city is required to prepare a 5-year consolidated plan in order to implement any federal programs that fund housing, community development, and economic development within the community. This plan was already developed and the city has chosen to use the COVID-19 funds, the CARES Act funding, to amend our 5-year consolidated plan and our fiscal year 2019 plan, so that these funds will be available sooner than if we were to include this with our new consolidated plan, which is 2020-24 fiscal year 2020 plan. And the 2015-2029 plan, this plan serves the following functions. It's a planning document. It's an application for CDBG funds, home funds, and ESG funds under HUD's formula grant. It's a strategic document. It's an action plan that provides the basics for assessing performance and investment of CDBG, home, and ESG funds. For the 2015-2019 plan, for 2019, the following 6 priorities and subsequent goals were identified. They were housing priority, which is there's a need to improve the quality of housing stock in the community by increasing the amount of decent, safe, sound, and accessible housing. The goals and strategies were housing rehab, rental rehabilitation, housing construction, fair housing, home ownership, public housing. B was homeless priority. There's a need for housing and support services for homeless persons and persons who are at risk of becoming homeless. And the goals and strategies were continuum of care, operation and support, prevention and housing, permanent housing. C was other special needs priority. There's a continual need for affordable housing, services and facilities for persons with special needs and the disabled. And the goals and strategies were housing, social services, and accessibility. D was community development. There's a need to improve the public and community facilities, infrastructure, public services, and the quality of life for all residents in the community. And the goals and strategies were community facilities, infrastructure, public services, accessibility, public safety, code enforcement, clearance, revitalization, historical preservation. E was economic development priority, and the goals and strategies were employment, financial assistance, redevelopment program, financial incentives. F was administration, planning, and management priority. There's a continual need for planning, administration, management, and oversight of federal, state, and local funded programs. And the city has identified a priority need, strategic plan goal, an annual plan goal, which would provide facilities in support of the pandemic response and recovery efforts. The goal is to assist in providing facilities, new, expanded, retrofit, special economic development, assistance to businesses, public services and/or planning, and emergency solutions. That's our emergency shelter, operating costs, essential services, rehabilitation, equipment, and homeless prevention that could enhance our community's response and recovery from the impact of the pandemic. Our community will place a high priority on providing facilities and services in support of a coordinated pandemic response and recovery. And now I'll go over the overview of the substantial amendment fiscal year 2009 annual planning process. At our second public hearing, which was for our 5-year consolidated plan for 2020-24 fiscal year 2020 annual plan, the city announced at that meeting at 10 a.m. and at 6 p.m. that we had received CDBG COVID-19 and ESG COVID-19 CARES funding in the amount of $1,866,324 for Community Development Block Grant and $931,503 for Emergency Solutions. Applications were due for this funding on April 13th. The applications were reviewed on April 14th. There was a mass email inviting sub-recipients and stakeholders to call in for this public hearing, which is today, April 22nd. The email went out on April 17th. Notice was placed for the substantial amendment in the newspaper on April 20th. The substantial amendment was also placed on the City of Erie's website, where it is still available. Today is the public hearing for the substantial amendment. We have the one at 10 a.m. and then there is one at 6 p.m. We look to have the adoption of this substantial amendment to City Council on May 6th. And then we look to submit the substantial amendment to HUD on May 6, 2020. And now, Chris, I'll turn it over to Chris, who'll go over the overview.
Thanks, Deb. Now I'd like to provide an overview of the proposed amendment to the fiscal year annual action plan for 2019. This overview will include the amount of additional CDBG and ESG allocations as part of the stimulus, and then specific projects and activities that we look to fund with that. So again, the amount of additional community development block grant funding as part of the stimulus is $1,866,324. The amount of additional funding for emergency solutions grant is $931,503. I'll now conduct an overview of each activity within this community development block grant category. Within the community development block grant funding, there are three main categories. First category being building and improvements, including public facilities. This is to support the acquisition, construction, reconstruction, and installation of public works facilities and other improvements to support treatment and testing centers. Within this category, there is one activity that will be funded. It is for St. Vincent Hospital, $354,392.81 to go towards the construction of a facility for testing, diagnosis, or treatment, and to assist with the facility enhancements and testing availability, location to test and provide care for potential COVID-19 patients. In the second category, assistance to businesses, including special economic development assistance, there is an activity set aside for $391.39 for special economic development. This is to provide grants and loans to support new businesses or business expansion to create jobs and manufacture medical supplies necessary to respond to infectious disease. This will also support working capital assistance in an effort to avoid job losses by business closures as related to social distancing, and to assist with the retention of jobs held by low and moderate income persons. Second activity within that category, $25,700 for economic development. This is to provide technical assistance, grants, loans, and other financial assistance to establish, stabilize, and expand micro enterprises that provide medical, food delivery, cleaning, and other services to support home health and quarantine. Third category for the CDBG funding is public services. The public service cap has been waived. We look to fund public services in the amount of $588,999. This provision is to provide increased public services. Activities include $50,000 to UPMC Hammond Hospital to provide testing, diagnosis, and other services at a fixed or mobile location, and to provide free testing and vaccinations once a vaccine is developed. Second activity would be $32,632 to Allegheny Health Network St. Vincent Hospital for the same purpose, to provide testing, diagnosis, and other services at a fixed or mobile location, and to provide free testing and vaccinations once developed. Next activity in this category is $75,000 to the Martin Luther King Center, $75,000 to Booker T. Washington, $75,000 to the Urban Erie Community Development Corporation, $75,000 to the YMCA, and $75,000 to the Sisters of St. Joseph Neighborhood Network. All of those activities would be supporting the funding that would help provide food and other resources to food insecure residents and others who are under stay-at-home orders. The last activity within this category is $131,367 to the Erie City Mission to provide essential services and recovery programs during the COVID-19 pandemic for clients with addictions to drug and alcohol. Next activity is a planning activity, $13,200 to the City of Erie Planning Department to help develop survey materials to capture the impact of the COVID-19 pandemic on residents in low to moderate income neighborhoods in the city. Last category for the CDBG funding is delivery and administration in the amount of $360,640.80 for the administration of the program, planning and management cost. This brings us to a grand total of $1,866,324. Next, I would like to review the proposed activities for the Emergency Solutions Grant funding for COVID-19, which is for shelter activities. First activity is for $298,672 to the Erie County Department of Human Services to support the operation of emergency overflow shelters. $223,720 to the Erie City Mission for operations and essential services for the Samaritan Care Emergency Shelter. $32,335 to the Erie United Methodist Alliance for emergency shelter. $25,000 to Community Shelter Services for emergency shelter. $50,000 for transitional housing to the Mercy Center for Women. $208,626 for homelessness prevention, including assistance with rent to the Greater Erie Community Action Committee. And last category, total administration of $93,150 for administrative and management cost for the Emergency Solutions Grant. Brings us to a total of $931,503. At this point, I'd like to turn it back over to Deb for a quick review of our next steps. Deb?
Thank you, Chris. The next steps for the substantial amendment, the comment period will end on April 29th, 2020. If you care to make comments, comments can be mailed or emailed to me at dsmith@erie.pa.us. The adoption of the substantial amendment for fiscal year 2019 will be submitted to City Council on May 6, 2020. The submission of the substantial amendment for the fiscal year 2019 plan will be submitted to HUD on May 6, 2020. We have not received a date for the release of the funds from Congress or our agreements from HUD, so at this time we will not be able to incur any expenses because we don't have a date yet. So those are the next steps. I'll turn it over to Chris, who will give you information on making public comments.
Thanks, Deb. At this time, we would like to open up the phone line for public comment. I do want to stress that this is a public comment period. This will not be a question and answer back and forth discussion, but it will be open for public comment. Is there anyone that would like to make a comment?
You can make it 4 of us, except for the site thing with JFK, and, that would be the numbers, I would assume, unless you have some other opinion on that.
Comment or not. Is there anyone that would like to make a comment at this time?
Yes. This is James Sherrod.
Hi, James.
I just want to acknowledge and thank the city administration for understanding the significance of giving us funding to go out to our community and ensure that the families that we work with that live between Cranberry and Bird Drive from 28th Street down to the waterfront are able to receive food and necessities during this COVID-19 situation. Without the help of funders and the city and the county that you're providing access to, potentially, we wouldn't be able to meet the needs of the people within our community. So, on behalf of the Minority Community Investment Coalition, the Booker T. Washington Center, Urban Area Community Development Corporation, and the Martin Luther King Center, we just want to acknowledge and thank the city administration for the potential to receive the funds that have been identified. Thank you.
Thank you. Any other comments?
Hello?
Hello?
Am I on the line?
Yes, you are. Thank you.
This is Freda Tepfer, and I have a comment. I'm concerned about the current situation where there is no place during the daytime from 10 a.m. to 8 p.m. for the unsheltered homeless to go. There's no safe place. There's no warm place. And I don't know whether that is being addressed, but I am concerned that that needs to be addressed.
Okay. Thank you, Freda.
Thank you.
Anyone else would like to make a comment? Any other comments at this time? Hearing none, then this public meeting for the proposed substantial amendment is adjourned. Thank you.
Thank you.